Welcome back. You're still watching SA Today, and we continue with our coverage of the COVID-19 coronavirus. So we saw a little bit earlier on the Minister of Health, Dr. Zweli Mkhize, giving a recent update in Pietermaritzburg, where the 38-year-old man who is the only person in South Africa to have tested positive for COVID-19 apparently lives. And he was saying that this disease has not spread. There are no other cases in South Africa. Well, to talk to us a little bit more about prevention on spread and containment of the coronavirus, we're now joined from our Pretoria studios by Professor Anton Stoltz from the University of Pretoria. Thanks so much indeed for joining us, Prof. So we have one case that's confirmed, and it would appear, as long as it doesn't create a community type infection process, we're still relatively safe.
Okay, when you say relatively safe, that is something, but I think if they have looked at all the cases and they haven't found any case around it, it means that's the only case. Okay, so I'm convinced that the NICD has done a good job because there's a lot of teams outside there, and I'm convinced that that is what they were doing. So I'm convinced that we don't have to panic about it. I mean, if they have looked and they have found nothing, then there's nothing at the moment.
All right, so you also work at the Steve Biko Academic Hospital, and I'm just wondering, have people started coming to the hospital for testing?
Yes, they actually, actually in January already there was people coming slowly in. Since last night it was quite busy, this morning busy, and I will go back to the hospital now again because there's more people waiting for me.
On average, how many people would you say you've tested just at your hospital?
So we don't test everybody that we see. So if I would say how many I've seen, I think it's around about 14 to 16 now, or a little bit more. But we have tested only 4. So with each case that I see, I discuss it with the NICD to make sure that we agree that we will either test or not test. So it is very important that we do not test the cases that we think is not SARS-2 or COVID-19.
All right, and what informs who you test?
Pardon, I couldn't hear.
I said, what informs who you test?
Okay, so what is happening, we use the case definition, but of course, the case definition is one thing. You have to use a little bit thinking about your case, so it's not always straightforward. But if we have a few doctors that's thinking about it, then we can say, listen, it's not fitting the case definition. The chance is extremely small, and this would rather be something else. So usually we do find another disease. We follow up these patients to make sure that if they get ill, we actually see them again. And then, of course, what we hope to do is that to make sure that if the COVID tested negative in the first test, which can happen, we will follow them up. And if they get more ill, we will see them again and test them again.
How ready would you say our hospitals are for any kind of step up in this virus in South Africa?
Okay, I can basically only speak for Steve Biko Academic Hospital, and you know, we are ready to see the patients. We are seeing them. We have plans. We have a group of people coming together once a week at the moment, the outbreak group. We have different doctors that's on standby. We have groups of doctors that will, if there is an increase in the amount, that what will happen is they will actually proceed and take over the patient from us if they test positive. I will keep on looking for new cases as they come in. So the plan is on the table, and what we will do is we will deal with it as they come in.
Is there a protocol for treating people who might test positive for this? Is it like treating flu, or is there something else you have to do on top of that?
It's a difficult question. I mean, there's so many studies ongoing, but as the results are not out yet, at the moment, what we will do is that we see them as a infection from the community. So it's community-acquired pneumonia. We will treat for that with antibiotics. On top of that, what we usually do is treat with a viral drug if it's influenza in the background and not the COVID-19. We will cover that. And then, of course, at the moment, we will treat all the symptoms that the patient has got. Up to now, like we know it's only one case, but we know from all the countries in the world that it can get very serious, and we also have a team on standby for intubation and ICU, so everybody is on standby and waiting. As soon as we have a case that is struggles to breathe, they will be intubated if needed, if the criteria is met, and then what we will do is that we will proceed and putting them into the isolation ward that we have, and then from there we will look at them, almost every minute of the day.
All right, the winter cycle is nearly upon us, and I just wonder, this is the time of the year where we get flu shots. Might this help boost immunity against this kind of virus?
No, I don't think it will help for COVID-19. But what it will do is, that's very important, that if you take your flu shot, then your chance of getting the flu is less. Then, of course, the amount of people that will come to the hospital with flu instead of COVID-19 will be less, and that will help us because it's very important that we, if we are getting overwhelmed by people that think they have got corona and they have influenza, then it's quite difficult. So, yes, I think it's very important that people take their shot. I also told my doctors, all the doctors in the hospitals, please take their shot, and they actually have done it for years now, because every time that you take a shot, you actually build up your immunity to different viruses of influenza A and B.
All right, and then perhaps as a final question, and this is something that we can't keep asking enough, what should people be doing on a daily basis just to minimize the risk?
I think the first thing is, if you have traveled and you are ill, please don't go to work. I think that's important, that you know that you must go to a center, to a doctor, or to a hospital, and please ask for advice. I think that's important. The other thing is that we know that this disease is spread, droplets, and we know it's contact spread, so you have to wash your hands. You have to make sure that these small particles is not coming, it's not lying everywhere. And when people are coughing around you, I think you must keep your distance. I'm not convinced that if you use your surgical mask outside in the open that it will make any difference. So what we say is that if you are ill, you put on your surgical mask and you inform your doctor that you want to be tested. You don't go into the practice or into the hospital. You phone before the time. I think that's very important for us. We meet our patients outside. We discuss first with them, and then we take them into our isolation ward, and then we actually look if they're ill or not.
I know that there's a lot of research that's playing out at the moment, and people testing vaccines already. How much do we know about this virus? I believe that the Chinese say that there could be 2 strains of it.
Yeah, we actually yesterday had a high-level meeting. And some of the people that was in the meeting were talking about the genetics of this virus, and it's clear to me that we are not still sure where exactly it comes from and how what it consists of. So we have the genetic profile, but that doesn't help you a lot. So yes, there is some of the SARS and things, but the problem is that we don't have enough information at this stage to actually say exactly what we know where it's coming from. We think it's bats, but there must be somewhere that it was transmitted from the bat to the humans. So there must be something else in between.
All right, Professor Stoltz, thanks very much indeed for your time and your insights. That's Professor Anton Stoltz from the University of Pretoria, who also works at the Steve Biko Academic Hospital.